So these are the few important scenarios in the gonorrhea. So you again refer to the gum clinic, preventive medicine, gum clinic, or other local specialists. So gum clinic. Arrange hospital admission for people with suspected disseminated gonorrhea. If they're women with severe or complicated pelvic inflammatory disease, offer screening for the sexually transmitted diseases, ceftriaxone. So this is the medication you need to remember for the gonorrhea if you're suspecting that. This is what you need to do. And regarding the bacterial vaginosis, is usually treated with antibiotic tablets, gels. So if the patient says that it's a sexually transmitted disease, bacterial vaginosis, no, it's not sexually transmitted disease. If you have same-sex partner, they may also need treatment as well. Things you can do yourself to help to relieve symptoms, prevent bacterial vaginosis returning. Use only water and appropriate emollients such as dermol 500 to wash your genital areas. Have shower instead of baths. And do not use perfume soaps, bubble bath, shampoo, or shower gel in the bath. Do not use vaginal deodorants or washes or douches. Do not put antiseptic liquid in the bath. Do not use strong detergent to wash. Bacterial vaginosis is important, so I want you to manage it. I'll ask some concerns, and you have to answer those concerns as well. So Nida, you have to manage it. Okay.
You do it, doctor.
Sorry?
You do it. I'll.
Okay, I'll do that. Okay.
Yeah.
But the concerns would be that doctor is this transferred by sexually transmitted diseases.
Yeah.
Okay. And so these are the things. So I'll try to manage it. Okay, Lita, after having a chat with you and after examining you, at the moment, I'm suspecting you're having a condition which is caused by a bug. We call it bacterial vaginosis. Have you ever heard of it?
No, doctor.
So bacterial vaginosis is basically, let me explain to you. So as I mentioned, it's caused by a bug. And the little thing which I'm a bit worried about you, that you are very embarrassed about this condition, is very smelly. So that bug basically is related to causing that smell. It's a bacterial one, okay?
All right, okay.
But don't worry, we can treat it. We just need to start you on a medication. We call it metronidazole. You happy to do that? Okay. A few more things. As you mentioned that you use perfume soap, bubble bath. Is that possible that you'll try not taking baths? You'll try to take showers? That
All right. Yeah.
That. And one question you asked, that is it transferred by sexually transmitted? I would like to tell you it's not transferred by sexually transmitted. It's not a sexually transmitted disease. Okay. So, and you mentioned, can it happen with the same-sex partner? Yes, it can happen with the same-sex partner, and both of you might need treatment.
All right. Okay. Okay, doctor.
And a few more advices I would like to tell you. Do not use perfume soaps, bubble bath, as I mentioned. Do not use vaginal deodorants or wash or douches. Do not put antiseptic liquid in the bath. Okay. So these conditions are few things. Few things I would like to give you a reading material to know more about this condition. If you develop any fever, any tummy pain, or increase in discharge, then you might need to come back to ED. Okay.
Right. Okay.
That's fine. So trichomonas is not important. Pelvic inflammatory disease is don't come in the, but that's fine. So the important one is that one, PCA demanding patient. So the PCA test is usually, so the patient would say, I want to get the PCA. So he would be 50-year-old. So it would be a combined station. So when you will check the prostate, it won't be palpable. The prostate won't be palpable. So, but still you will refer the patient to the getting the PCA test. PCA test is usually offered to a man above 50 years, but not very specific for prostate cancer. If PCA is raised, it may be a sign that you have got prostate cancer, but need further investigation like MRI and prostate biopsy. So you will explain PCA is a test for screening. It cannot be 100% right. So there are few benefits and risk of, there are few benefits of doing PCA that you will be able to screen that. But there is another thing, but sometimes it can come as a false positive, and which may give you some stress until you being further investigated by MRI and other biopsy, because the most of the time PCA itself not 100% right. So in this way, we might need to do further tests. Benefit of PCA is that good for early detection of cancer, but also false negative means that it will be normal even if you have prostate cancer, and false positive that PCA will be elevated even if you don't have. So we'll take a quick break, 10-minute break, and after that, we'll try to cover rest of scenarios. Okay, guys, then we'll be back. Okay, welcome back, guys. So let me quickly see the syllabus, what we had to cover today. Then I'll tell you what are the important things which we have covered and what we will be covering for further. So basically today in the today's syllabus, what we was supposed to cover, the Breaking Bad news, we put a lot of time on the Breaking Bad news. And now the skin lesions, these are the only scenarios which we had to do on the skin lesion in terms of exam, because the masterclass is basically we are focusing on the part of the masterclass which are very important and high yield. So we are trying to tell you guys what is most important and how you can deliver that information. So let me quickly see the other topics what we need to cover today, because till 6 o'clock I have to tell you all of the important things which you might able to see in your exam. So the next thing which we are going to cover is, so we have done the ENT dermatology important scenarios. So women health we have to cover, child health we have to cover, male health we have to cover, and then we will be covering I will be telling you the approaches for the sim and combined station and surgical one as well. So those are one one-scenarios. In the women health, there is a PV discharge, and there is a few other things. The male and female health both will be doing together. So in the male and female health specifically, what we need to do is the sexual history part. So how you are going to take the sexual history. So that is the most important thing, how you will be taking the sexual history and what are the most important presenting complaints you will be seeing. So one we have done in the female, the bacterial vaginosis, that's the most important thing you might see in the woman health or male health. Okay. And apart